This talk is our new talk for this year. It's the first time I've given it, so let's see how it goes. We've called it 10 things we all need to know about men's health. So this is yes, very much focused on men's health, but it's for men and women, anyone with men in their lives. Some key things we'd like you all to know about men's health. Now, I'm going to say right from the start that we're going to cover quite a lot of information, more than you can probably take in. And so I'm going to make it really easy for you. And I'm going to invite you to listen out for one fact you want to remember. And even more importantly, to listen out for one action you think you could take after today's talk. So don't worry about taking notes or remembering everything. There's not going to be a big quiz at the end, but see if you can pick out one fact that really resonates for you to remember and identify one action that you personally think you could take after today's talk. So, as with all our Know Your Man Facts talks, we go through 4 different areas, which are some key facts, a bit of focus on your health, some ideas on how to take action, and some thoughts about how we can help others. And we're going to start with some big, shocking statistics about men's health in Australia by way of a quiz. So let's have a quick quiz. Use the chat box. It's really easy. You just have to type in a number. We've given you some prompts here. You got a 1 in 5 chance. I pretty much guarantee it's going to be one of these 5. How many Australian men each day do you think die from preventable causes? And that's under the age of 75. So let's see you check a few answers in the chat box. Greg's gone for 50, 50, 50, 100, 50, 50, 50, 25, question mark, 100, 50, 50. It's great. Coming in 25, 25. It's for like a horse racing commentator here. Yep. Great. Good to see so many people involved. No one's saying 5 or 10. Everyone's going between sort of 25 and 100. And the most common answer is 50. Last chance to check in a number before I reveal the answer. The answer is it's 50 men a day. That's quite a shocking number. It's 50 men every single day in Australia dying from a cause that could have been prevented before the age of 75. So that's, one of the reasons why the conversation about men's health is so important, because we've all got men in our lives and that we love and we care about, and we'd all, I'm sure, like them to be around a bit longer, including selfishly ourselves. Some blokes, though, don't even make it to 65. So here's another quick quiz. 8 options this time. How many men do you think die before they reach even the age of 65, before they get to retirement? Pop your answers in. 1 in 8, 1 in 10, 1 in 2, 1 in 3. Yeah. I'm just watching the answers come through. Thanks all for participating. Number 4. Thanks, Steve. Thanks, Abdullah. Thanks, Alicia. Thanks, Patrick. Good to see Patrick again. There's a name I recognize from yesterday. Thanks, FD. Okay. You got 5 more seconds. 5, 4, 3, 2, 1. Yeah, it's 1 in 5. So, the way I sometimes sort of ask people to think about this is, particularly for those of us under 65, imagine a friendship group, or imagine if you're, out with a few mates and there's 5 of you, in your 30s and your 40s and your 50s. Chances are that one of you won't make it to 65 on average. And that's quite a sobering thought. Now, men's health and women's health. Let's go through these one at a time quite quickly. Probably this won't be surprising to you, but it's just to get us to reflect on a key issue I want us to think about. Firstly, who's more likely to die from avoidable causes, do you think, men or women? Thank you for answering. Yeah, a big flow of people saying the same thing, and it won't be surprising that most of you are saying, yeah, men. Someone saying, of course, men. Okay. Yeah. Both men and women die prematurely from avoidable causes, but men are more likely to do that than women. What about if we just look down at the sort of the the less wealthy people, the lowest 20% of Australians in terms of in terms of their wealth, their income, poor men or poor women. Yeah. So a few more people. Again, common theme emerging. Someone's chucked in poor women, but most people have said poor men. Yeah, not surprising. Yeah, poor men. I got people. Wow, I didn't know people had that power. Jeff, you're circling the circling things. That's brilliant. Someone who's got more Zoom skills than me. Yeah, it's poorer men and poor women. The poor men are more likely to die for them than poor women. What about rich men or poor men? No prizes for this one, but chuck the answer in there anyway, as we make the point. Yeah, of course. Dan said rich men. Okay, that's actually poor men, but that's good. Good, same. No, not the same. Quite a big difference between rich men and poor men. And then the last one, the poorest men or the richest women. Jeff's in there for us, underlining everything. Thanks, Jeff. Don't give it away to everyone, Jeff. Poor old men. Yes, poor old men. Yeah. Yeah. So probably not that surprising from the answers. I think we got a sort of a 99% success rate there. But always something I nice comment, Anton. Geez, I've got to earn some more money. Yes. If you don't, but don't stress yourself out and give yourself a heart attack trying to earn more money. There's always a balance to be struck. So yeah, this is what we call, the social determinants of health, and you see that quite starkly when you just look at the rates of death and illness between different groups in society. One of the key ways we do that is we look at people in groups of 20%. So from the five groups, from the very poorest to the very richest in society. And we see massive differences across all sorts of measures like heart disease and cancers and rates of smoking and being overweight and all sorts of measures across these different ranges. And basically, this is number of deaths. The poorer you are, the more likely you are die prematurely, and that has an impact on both men and women, as you can see from that graph, but it has a more profound impact on men than women. And we call that the social determinants of health. Um, and one way that health professionals use this information, and you'll get this in a lot of government reports, is they'll say, well, let's imagine what would happen if everyone had the same health as the wealthiest 20% in society. And they'll say something like, just making up a number, that if everyone had the same rate of death from heart disease as the richest 20%, we'd save the lives of 10,000 people a year, which makes the case for actually taking action at a sort of society level to improve everyone's sort of wealth and well-being to improve their health outcomes. So we did a quick calculation which asked the question, how many preventable deaths could we how many preventable deaths could we avoid if everyone had the same rate of death as the wealthiest 20% of women? And we roughly calculate about 15,000 people, 15,000 lives a year would be saved. Some of those would be women's lives, and most of them would be men's. So when we look at the impact of wealth inequality, rough measure, but 75% of the deaths that are sort of linked to wealth inequality are deaths in men. Now, that's a really big sort of man-fact topic to try and wrestle with, and not something that we can resolve in a day. So we're also going to look at some areas of health where we can take action today. So there are other areas that impact our health, things like our environment, our habits, and our health status. And whilst the figures aren't quite as stark there, you can still see that there's a slight overrepresentation in men at every level. So more death, and these are the number of deaths per year. More deaths linked to our environment, more deaths linked to our habits, and slightly more deaths linked to our health status. And in the next section, we're going to look a little bit at what we mean by those three areas: health, environment, health habits, and health status. And as we do, we're going to shift to sort of thinking more now about your health as opposed to just health in general. So if we look at environment first, there's types of things that impact men more than women in terms of environment are workplace habits, hazards. So, not just deaths in the workplace, but exposure to different sort of pollutants and uh, things like that. Uh, Exposure to sun, so that's mainly skin cancer, and even exposure to air pollution. Some of those things we can take action to control. Now, looking at health habits. So, another bit of a quiz for you. We've got a list of about 12 sort of habits, risk factors, lifestyle factors, behavioral factors that can impact health. But I'm not going to just tell you, I'm going to ask you what do you think they would be? The sort of key things that we do or don't do, or we might be exposed to that impacts our health. Back to the message section. Smoking and drinking, says Mikhail. Yeah, little smoking, diet and drinking, sleep. Yeah, Duncan's got inactivity. Good to see you, Duncan. Um, Stress, yeah, worry and stress, social isolation, lack of exercise. These are all good suggestions. Poor diet, drink, social media in a negative way, diabetes and diet, not talking about it with peers, snoring and sleep apnea, not enough money. Yeah, um, loneliness. Yeah, some really good suggestions there, and lack of minerals from David, and all relevant. So we've just picked out 12, but everything you're saying is also relevant. Diet, fatigue, lack of understanding of our medical well-being, depression, unemployment. So yeah, a lot of factors here which are all relevant. Lack of social support and engagement. Really great. Dehydration, absolutely. Drink some more water. Our mental health, yes. Yeah, so loads of things. Loads of things. Here are sort of 12 key ones, but not by no means the only 12. So one of the points here is that I'm assuming you can all see that um, some of these are within our control. Smoking, um, diet. Um, some of these are we have less control over. We don't have control over our age, and we can't change our family history, though we can actually sort of go and find out about our family history. We have more control over the amount of alcohol we consume, or if we are using drugs. So some of these may be relevant to you. I imagine that for everyone present, at least one of these is relevant. And this is one of the areas where you might think about, well, is there one action that I might take? Could I be more active? Could I improve my diet? For me, I'm a big one for the step count. So I really like to keep physically active. I know it's great for my both my physical and mental well-being. And I'm a keen runner. And most times of the year, I'm easily knocking out 10,000 to 20,000 steps a day. But you know what the irony is? One of the times of the year when that step count goes right down is Men's Health Week, when I'm spending so much time at the desk or on the phone that I'm hardly moving, and my step count can often be below 2,000. So one action for me today is I know I'm not going to have the energy to go out for a run. So instead of doing what I did last night, was I drove down to the pizza place, got a pizza, drove back home, and went to bed. Is I'm going to make a point of at least going for a 30-minute walk tonight. Uh, uh, Unlike Anton, who's just said, I only run if someone is chasing me. I actually do quite like to run, but maybe someone can buddy up with Anton and offer to chase him so he can improve his weekly step count. So you know which ones of these are most relevant to you, but just out of interest, here's some facts about the ones that are the biggest risk on average to to men's health in Australia. And this is which of these habits are most likely linked to someone's death. Perhaps not surprisingly, smoking is the big one, obviously massively linked to lung cancer. But diet's also a massive one. Um, Alcohol, lack of physical activity, and drugs. Those are sort of some of the five key habits that we want to be aware of because they're most likely to be linked to poor health and premature death. Great to see the chat going on. I see Jacko is now offering to chase Anton, so that they'll both be running. Great. This is great. Peer support happening in this very room. Um, there's a fine line between being an exercise buddy and being a stalker, though, Jacko. So just make sure that there's consent there before you start chasing Anton. Okay, next question. This is more about health status. There are different ways of measuring our health status, but there are four key numbers that we should all know. So who wants to guess what those four numbers are? And it doesn't include someone's phone number. It's numbers about you and your body. So we've got one guess there. BMI, that's good. LDL level. Thank you, Karen. Blood pressure. Thanks, Daniel. Doing well here. PSA, that's a good one, Nicholas. Cholesterol, a couple for cholesterol. BMI for Abdullah, thank you. I think we may have nearly all of the above. That's the way to go, Patrick. What they said. Yeah, weight, skin check. Yeah, hours of sleep per night. Good one. Yeah, yeah. Okay. Again, all good answers, and this is not a definitive list. Uh, Adrian, calcium levels, true indicator of heart health. I think Duncan will agree with that. I know he's a big advocate for that too. So the four basic ones that you want to know at any age really are these four: blood pressure, blood sugar levels, cholesterol, and body mass index. And it's pretty easy to go and get those checked. If you're 45 or over, you can get those done on Medicare as part of a standard heart health check. But if nothing else, in terms of awareness of our own body, these are the sort of the four basic ones. But then there's many, many others, some of which you've actually identified. Right, we're going to move on now. Uh, Adrian, that's a really good point. Yeah, you can actually go into a number of pharmacies around the country, and there's actually machines that you can use to get a check. What Adrian's calling the SISU stations, which are often found at Priceline pharmacies. It'll take your blood pressure and other measures. So you don't even have to interact with a human being. You can get a robot to do it for you. So moving on now to actually thinking about taking action. And remember, my invitation to you at the very beginning was if you just get one thing out of today, see if you can identify one action that you might take. So we're going to focus in on some of the actions now. So the first point, talked a lot about sort of physical health and physical habits. But I want to highlight this very important point that there's a really strong correlation between mental health and physical health, links between poor mental health and heart disease and weight and risk of smoking and many other factors. So one way to take care of our physical health is actually to work on our mental health. So here's another quick quiz. And again, there's just so many answers to this question, but we are thinking about tell me what are some of the things that we can do to stay mentally healthy. We've identified three general ones, but there's loads of answers you could give. Exercise is great. Hey, Bill, good to see you again. Exercise, meeting with friends, sleep, exercise, and diet. Great. So social connection. Sleep's coming up a lot this year, mindfulness and meditation. We usually have a talk on sleep. We haven't done one this year, and it is a very important thing. Laughter, says Matt, absolutely. Something other than work, I certainly agree, especially during Men's Health Week. Music, for example, absolutely. Spending time with good men, says John. I know you're a big fan of men's circles, John. Good to see you. So yeah, I'm sure you are leading by example there, spending lots of time with good men with all those awesome men's groups and men's circles that you're involved in. Get off the phone before bedtime. Good idea, Chris. Meaningful work. Yes, one thing I know I'm very fortunate to have, and it does make a difference to my mental well-being. Community, eating well, life balance, hanging around positive people, definitely, Anthony. Medical checks, absolutely. Investing time in community and hobbies, playing and being involved in sport, less screen time, yes, and having clarity about purpose. These are lots of great suggestions. Let me give you our three key ones that sort of try and capture probably most of the things you've already said. So, number one is actually maintaining a healthy body because whilst we've already said that you're having good mental health improves your physical health, it also goes in the other direction. Lots of evidence and exercise, being involved with sport I give the example of I was down in the Gold Coast for a men's health event at Goldstone United Football Club on Saturday, and I'd driven most of the way. And as is often the case when I'm traveling for work, driving, sitting down, stopping at a servo, getting an unhealthy snack, staying at a motel, not getting good sleep, having a takeaway instead of cooking something. Um, my health can sometimes suffer a little bit when I travel. But one of the things that I have in my locker, and it was on at the weekend, is that I mentioned running already, and I really love taking part in something called Park Run, which some of you will be familiar with. But if you're not, basically, Park Run is a community event, takes place on Saturdays, pretty much always at 7 a.m. in Australia, though some are a little bit later. There's a few hundred around the country run by communities, by volunteers. And as a participant, you just got to show up, um, take part, and if you want, you can record your time at the end and you get a record of your time. So I made a point on Saturday of going and doing a park run at I think it's called Kirra on the Gold Coast. First time I've been there. Just before I went to spend the day at a men's health week event, and I asked the guys at the very beginning because I was talking about men's mental health in particular. Um, what were some of the reasons they thought that for me doing a park run uh, was good for my mental health? I'm going to invite you to answer that question. So why do you think, for me, doing a park run every now and then is good for my mental health? Great. So David said social. Yeah, exactly. Um, sense of NT. Not sure what NT is. Meeting people, relieving stress, getting outdoor. Yeah, totally. You guys have got it. Sense of achievement. Totally. Getting up early and doing exercise. Exactly. Yeah. So this is a little having a routine, having activity, being surrounded by motivated people, keeping healthy, enjoying the environment, a change of pace. Yeah, all of these things. Any exercise is excellent. Yeah. So absolutely 100% because it's physical exercise, but it's the added benefit of all the other stuff. It's connecting with other people. It's being in nature. It's going to a new place and getting a new sense of perspective. Just don't pull a hammy. Well, thank you, Anthony. I have pulled my cars a few times this year, but you can still walk at Park Run. You're very welcome to walk. Mikhail, enjoying a beer after that. Well, it is 7 a.m. in the morning, so probably a bit early for me, but absolutely having a beer after exercise with some mates is certainly a good one. Maybe not at 8 a.m. Don't want to be too judgy, but maybe more of a coffee afterwards. And I also am one of the people who, at my local park run, will volunteer. So volunteering and giving to others, all things that keep us mentally well. So it's much more than just a 5 kilometer run. It's very different from when I go for a 5 kilometer run on my own, which is good, but to do it with other people for all those reasons is really powerful. It's one thing in my toolbox that keeps me mentally healthy. And I'm not saying that everyone else should do that, but it's like I encourage people to become aware of the things that we do the things that we're already doing that keep us mentally healthy. Um, so that's more than just a healthy body. That's about creating a healthy lifestyle. And with men's health, you'll know there's a lot of talk generally when we talk about men's health about what I would call a deficit conversation. What's wrong with men? Men don't talk about their feelings, men don't open up, men bottle things up, men don't get help. And there may be some truth in all of that. And what's missing from that conversation is a focus on all the things that men are already doing to stay mentally well, more of a strengths-based conversation. And for me, the starting point when we think about men's mental health and our own mental health is to first bring more awareness to the things that we're already doing. So, in terms of creating a healthy lifestyle, what are some of the things that you do, or you could do, or that others do that help maintain good mental health in terms of a healthy lifestyle? Duncan says men's table, which is for those who don't know, his is a men's group. And pickleball, yes, also another social activity. Any other ideas on creating a healthy lifestyle? Mentally healthy lifestyle. Meditation, says Scott. Making others happy. Yeah, thinking about others. Outdoor activities, great suggestions. Pleasant event schedules, soccer, avoid TV. Or for some people, watch the TV that you really enjoy. Mindfulness and meditation. Surfing, Dave. I think you said that a couple of times, haven't you? Bill, socialization. Yeah, these are all great suggestions. Giving back to others, Gerard. Yeah, fantastic. Mindfulness, meditation, fishing. Excellent. A men's coffee meetup each morning. That's awesome. And planning ahead, concerts and holidays. See, these are all great ideas. And if you're already doing some of these, you're already working to maintain your mental health. You might not even be realizing it. Let me give you two really shorthand versions of what creating a healthy lifestyle looks like. I got the first one from one of the oldest mentors in men's health, Professor John McDonald, who's retired now, but was one of the founders of the Australian Men's Health Forum and of men's health generally in Australia. And he said when it came to mental health, he got all he needed to know from a 1974 edition of the Reader's Digest. And it was basically you just need three things: someone to love, something to do, and something to look forward to, which I think is so beautiful and simple and has a lot of truth to it. I have one I prefer slightly more from Professor Martin Seligman, who was one of the founding fathers of positive psychology. And he says there's three different pathways to a happy life, and any one of them will take you there. And that's the pathway of the pleasant life, the good life, and the meaningful life. The good life is filling up your life with doing things that you're good at. The pleasant life is doing things that bring you pleasure and joy, and the meaningful life is doing things that have purpose and meaning to you, whatever that is. All of uh, all of which are things that you've touched on with your ideas. Um, and the third aspect of good mental health for us is also developing a healthy mindset. I think I might have a couple more slides on this and got stuck on this one. No, I haven't. That's okay. Go back. So, last one then. Yes, thank you, Chris. Happy wife, says David. Was it what is the more modern version to be inclusive of everyone? Happy spouse, happy house, I think is the latest version of happy wife, happy life. Um, so last question in this section. The other area is sort of developing a healthy mindset. Any thoughts on some of the things that we can do to have a healthy, mentally healthy mindset? Happy husband, suspicious wife, says Anton. Having a sense of humor is good for the mental well-being, Anton, and you've certainly got it. Anthony says read. Yep. Any other suggestions? Pray. That's absolutely that fits in with the meaningful life, time in nature, minimize exposure to public affairs, enjoy life, appreciate what we have. Yes. Positive animation. Okay. Volunteering, gratitude. Yes, practicing gratitude is definitely one of them. Yes, John agrees. Don't worry about things you cannot change. Yeah. Getting a balance of mind, body, spirit. Yeah, these are all great suggestions. So, and it's things like recognize and accept change. Very good. Thank you. So, it's simple things like setting small goals that you can achieve, reframing negative thoughts, being able to reframe things with humor. Get a dog, says Anthony. Absolutely. Um, Practicing gratitude. Um, these are all things that we can do at a sort of a personal level to sort of shift our mindset. And of course, we're speaking here a lot about the things that we can do on our own to change things in terms of our mental well-being. But also important to remember that there are times when we need others, and having people that we can reach out to and connect to, or indeed connecting to a professional if needed, are also important parts of our mental well-being. We don't have to do it all on our own. But yeah, that's our sort of like our guide to men's mental health in just about 5 minutes. It's basically about th three key things: maintaining a healthy body, creating a healthy lifestyle, and developing a healthy mindset. And this is the area where you might think of one thing that you'd like to do, one action you'd like to do more of, something you're already doing or used to do, um, as you get to the end of today's talk. So this next slide, just one slide, will lead us to more information, densely packed than any other part of this talk, and it's pretty much the last major slide. So we're going to move back to mostly physical health and remind ourselves that at times it's important for us to go and get stuff checked. And there's often a lot of focus around Men's Health Week about men should go and get checked, but then people rarely say what it is they should get checked. So a bit of a question here, a little bit of a quiz. Can you name at least seven different things that you can get checked at a GP or a health provider? A few people saying PSA, yes, cholesterol. Some of these we've covered already, skin, blood pressure. Calcium, there it is again. Bowel, absolutely. Prostate, good. Ticking off a few here. Yeah, blood tests, absolutely. Many different things that blood tests reveal. Heart, absolutely. So different body parts. Sugar levels, yes. Testosterone, absolutely. Any more for any more? It's a couple you haven't got. If you feel bad, ask them to check for... Yes, good, Chris. Ask them to check for anxiety and depression. Hearing, excellent, Duncan. Well done. That's helped us tick off another of the seven. I think we might have just about covered them all now, broadly. So we've got our broad seven sight. Absolutely, that goes in with hearing. So here are our seven. No, by no means an exhaustive list, but I want you to think about, is there one of these that you haven't had checked recently that you think you should get checked? Because that could be your one action to take from today. So the first one is the four numbers, which we talked about, which is part of the heart health check, but it's good for general health as well. Senses, we've mentioned hearing and sight. We also include teeth in there. It's not quite senses, but we couldn't put them anywhere else. Thinking about dental checks every sort of 6 to 12 months. Eyesight every 1 or 2 years. Hearing as you get older, or if you've been exposed to loud noise at work. Down under, any sexually transmitted diseases in particular, something we can check for. For those of us who are sexually active, various cancers. With men, obviously being aware of our testicles is important from an early age, and as we get older, the first cancer we get sort of invited to test for is bowel cancer. If you're 50 or above, you get a lovely 50th birthday present from the government, an invitation to send some poo in the post to the government. I recommend you do that. It's not often you get that invitation. And a few people mentioned PSA, so that's for prostate. And you had a great talk on prostate cancer on Monday. But just the general bit of information is if you're 50 and over, go and get your PSA tested. It's a blood test. And if you've got a history of it, we had a slide earlier about family history. This is why it's really useful to talk to your mum and dad and brothers and uncles about what illnesses are in the family. If you've got male relatives who've had prostate cancer, then getting tested for PSA as early as 40 is recommended. The heart health test is now available on Medicare from the age of 45 or younger if you've got diabetes or you're Aboriginal Torres Strait Islander. Someone mentioned about getting tested for depression and anxiety. That's the head part. Yeah, GPs can do all sorts of simple tests. There's some great online tests as well. You can do tests around stress and depression and anxiety. If you're struggling and want to just sort of get an indication of where you might be, there's simple questionnaires. They're more like questionnaires, those ones. Not like a blood test, or it's question and answer. And keeping a check on the old habits we mentioned earlier, particularly the smoking, drinking, diet, exercise, and weight. Keeping a check on those and identifying the ones that you need to take action to improve. One new one with cancer, I think it's just launched or just about to launch, which is the National Lung Cancer Screening Test for people who've smoked for more than 10 years. You can actually now go and get referred for a lung cancer test early on to see if you're at risk. And also, being Aussies, I don't need to tell you, skin cancer, skin checks are available all over the country. Right. Don't expect you to remember all of that, but I do hope that there's maybe at least one action that you think, maybe it's time I went and did that, either for the first time or because I haven't been for a while. So there's the question. What's one thing you could change for the good of the for your health? You're very welcome to chuck an answer in the message box if you're brave enough. Um, Certainly for me, Duncan said walk more. I'm just going to say exactly the same thing. Walk more. My tendency is to be all or nothing. So I'm either running lots of kilometers every week or then sitting on my bum for a couple of weeks. And I think just doing more walking. Oh, Mohammed, less sugar. I think I need to put that one in too. Less sugar, less gelatos for me. Bill making time. Mark, small consistent changes. Quite a few people about being more active. Greg, more sleep. Yeah, and good quality sleep, really important. Justin said more exercise that specifically gets my heart rate up. Yeah, that's it's important to do that a couple of times a week if you can, as well as sort of general moving around. Oh, loads of answers here. This is great. Anthony tried to lose weight, but very hard as we have age and injuries. Absolutely, I feel you, Anthony. I have a constant struggle myself with being a few kilos overweight. Um, David stopped drinking, started boxing and surfing, changed my life. That's awesome. Find what I want to do to not be bored. Good answer, Tim. Swimming. Tend to my bees. Lewis, I grew up with bees. My father was a beekeeper most of his life. Lovely to hear that other people are taking part in that beautiful hobby. Uh, Lutfi, eat nutritious food. Abdullah, lifestyle. Anton, have more free time to do fun things. Yeah, that's back to the having a pleasant life, the good life, and the meaningful life. John, eating less processed foods. 100%. Some great answers there, and really good to hear everyone thinking about the small actions we can all take to improve our health. So, how about others? Um, I think one thing that certainly the men in our circles are passionate about is helping other men, um, and we're always keen to encourage that. But we also say think about yourself first before you think about helping others. There's that whole thing, in an aeroplane, when the oxygen masks come down, they tell you to fit your oxygen mask before you fit someone else's. And I think that applies to health generally. Don't just be the person that's helping others and telling others how to be healthier. Think about how we can lead by example and take care of our own health, as well as looking out for the men in our lives too. So this is what we say in terms of taking action for other men. You can be a men's health champion. And one way to do that is to get to know some of the facts that we've shared today and tell others about them. Get people interested in men's health as an actual issue that we want to address collectively. And remember to take some action yourself, yourself, and be a role model. You don't have to be perfectly healthy. Just taking one small step, one action that keeps you mentally well, physically healthy is enough as a starting point, one first step. Um, and then tell your mates about that. And they'll be more likely to listen if you're doing it yourself. I've been for a heart health check. I got it on Medicare. I found some stuff out about my blood pressure and my cholesterol levels. Why don't you do it? It was really easy. I'm doing the bowel cancer test. I'm going to start walking a bit more. Will you come with me? Anthony says I'll run. Was it Anton who said he'll run if someone chases him? And I can't remember. Was it Jordan who said he'll come and help him? So yeah, we think health is not just an individual responsibility. It's a collective responsibility. It's something we'd like to see the government do more for. It's something we'd like to see the health system do more for. But at a community level, we'd like to see people doing more to help and support each other, which is why we're a big fan of men's groups like the Man Walk, the Men's Table, or organisations that are actually creating opportunities for men to connect and be healthy in community. And a couple of More suggestions here from you. David said about correct breathing. So yeah, lots of focus on breath work and breathing these days. And Matt's saying encourage open discussion when with mates, break down the perceived barriers. Absolutely. Lead by example. If you're open in what you discuss, then you'll find others are more open too. Scott's been raising awareness through footy and cricket group chats, which is brilliant. David likes to listen to heavy metal. Not my thing, and if it works for you, bloody awesome. Um, and yeah, anything else? No, I'm going to stop sharing now because I think, oh no, just we'll do a recap. Let's do a quick recap. Always reinforce the key messages. So we looked at 10 key facts across the talk today. We talked about how 1 in 5 Aussie blokes die before the age of 65 and 50 men a day under 75 are dying from preventable causes. And one of the things that's influencing that is wealth inequality. The better your wealth, the better your health. That's the way social determinants shape our health. But also things that we individually can take more control of, things like our environment, which we know impacts our health, our daily habits, which we have the most immediate control of, and our current health status, which we can find out about and take action to shift to improve our blood pressure, to reduce our weight, improve our cholesterol levels, and so on. We talked about how taking action to stay mentally healthy, having an awareness of what keeps us mentally well and doing more of those things can help protect us against poor physical health. And indeed, taking care of our physical health also supports our mental health in the opposite direction. You talked about the importance of being aware of what health checks are available to us. It's different for different men at different stages of our lives, but having an awareness of what checks are available, there's usually at least one check we should all be doing once a year, one or two, even if it's just getting back to the dentist or checking up on your blood pressure. And our challenge to you today, our invitation to you today is to think of one small thing that you could change going forward for the good of your health. And we also invite you, as long as you're taking action yourself, we invite you to be a men's health champion, to know the facts about men's health and share them with others, to take some action yourself, and then to tell other people about it as a way of being a role model and encouraging other men in your life to take small steps to improve their health and well-being.